I'm Jason Cheney. I'm one of the family physicians here at our clinic. 33 and married with 3 young children. Why I was drawn to this area was, obviously I grew up around here, so it was nice to come back to that same area, but also I knew I'd wanted to practice in a rural area and be able to expand my practice into what I wanted to do and not be limited by the confines of the hospital or hospital politics, where really we've got a lot of control over that. I wanted to come out, of course, do in family medicine, do full practice, full scope, OB, C-sections, all that stuff, as well as doing endoscopy and continue to do those type of small procedures. And it's really helped my practice, being able to have the freedom to do the things I wanted. It'd be, I think, a perfect situation for a surgeon, even one coming out, on his own. It's great physicians here to work with, the great facilities. The facilities are just recently updated. We've got a brand new acute care addition on the hospital. It's a year and a half old. Great nursing staff. The surgery department's all up to date. It was recently remodeled, I think, about 7 or 8 years ago. All new equipment, new scopes, new laparoscopic equipment. It would also, as far as fitting a new surgeon coming out to practice on his own, really the freedom to do whatever he wanted and expand into more than just maybe what he'd be confined to in a bigger city, and not maybe to get into some of the more special stuff that he'd perhaps have some interest in doing. And we've really looked at expanding the surgical capabilities of our hospital beyond just a normal general practice. Even if somebody's interested in doing some chest surgery or even some vascular surgery or some cosmetic surgery, we've always kind of wanted to encourage that scope of practice. If somebody's interested, really you're not really confined to anything. You can really, if you're comfortable doing something and want to try to do it here, I think it's wide open. And I think ideally it's an ideal situation for a surgeon, and another reason that we don't really have any mandatory set call for a surgeon, so to speak. What we've kind of discussed is that it would be if you're in town and we needed you to maybe look at something and you had the ability to, that would be it'd be good if you could take a look at it. But if you're out of town, we just would, if we have to send it down the road, we would just have to send it on down the road. But we would try to keep what we could here. And really, there's no set scheduled call for a surgeon coming out. And I think looking at somebody who's had a young family or want to start a young family, really the ideal place. We've got great schools. I think the time you would have with your family is much more open than what it would be in perhaps a bigger city, where you might be waiting on OR times and waiting on other surgeons at the hospital a lot, with a lot of downtime there. Where here you can get in and get out and do what you want to do and be home and really set your own schedule. And really is I think a perfect opportunity for somebody just kind of wanting to have a good practice.